4, 5, 6, probando audio en cabina de interpretación. Gracias. 1, 2, 1, 2, 1, 2, 3, probando audio en cabina de interpretación. 1, 2, 3, 1, 2, 3, probando audio en cabina. 1, 2, 3, 1, 2, 3, probando audio en cabina de interpretación. 1, 2, 1, 2, 1, 2, 2, 2, 2, ¿sí me escuchan? 1, 2, 3, 1, 3, 1, 2, 3, probando audio en cabina de interpretación. ¿Sí me escuchan bien? 1, 2, 3, 1, 2, 3. 2, 2, 2, probando audio, 1, 2, 3, 1, 2, 3. Probando audio en cabina de interpretación, 1, 2, 1, 2. 1, 2, 3, 1, 2, 3, probando audio, 1, 2, 3, 1, 2, 3, 2, 2, 2. 1, 2, 1, 2, probando audio en cabina de interpretación, 1, 2, 1, 2, 1, 2, 1, 2, 2, 2, 2. Probando audio en cabina de interpretación. 1, 2, 3, 1, 2, 3, probando audio, 1, 2, 1, 2. 1, 2, 3, ¿sí me escuchan? Sí, está llegando el audio, bien. 1, 2, 3, 1, 2, 3, probando audio. Sí, ¿todo bien? Good morning, everyone. It is an honor and a pleasure to be able to welcome you today. My name is Erika Paredes. I am a Regional Advisor of Strategic Alliances of the UN OPS, and I'm going to be moderating this panel. On behalf of the Office of the United Nations Office for Project Services, I'd like to welcome you to this second informational session that has been organized in an open way so we can have the participation of the public opinion, representatives of the Mexican market, of the international market, communication, civil society, and all of the stakeholders. Our main goal has been to provide and open for participation and disseminate the work that we've been doing along with the Mexican government. I'm very glad to see that we have a very broad participation here, and we have different representatives of the business companies in Mexico. We have Canifarma, ANAFAM, we are also with FIFARMA, AMELAF, AMIF, AMID, AMEPRES, INEFAM, ANDIS, AMEJI, and FEDEFARMA. Also representing the entire international market, we have a broad representation on behalf of the embassies. We have Italy, Canada, Denmark, Korea, Argentina, England, Sweden, Austria, European Union, the US, Colombia, Guatemala, Bangladesh, Bolivia, Hungary, Pakistan, Japan, India, Dominican Republic, Brazil, Egypt, France, Spain, and the Netherlands. So we would really like to thank you for participating in this information session today, and hopefully it is going to be as elaborated as possible. Also, in online rooms in YouTube, we are broadcasting a live stream where the rest of the people that I have already mentioned will have access to, all of our colleagues from the press, journalists, and civil society. We have two channels in such a way that you can broadly broadcast it, and we are going to be connected in Spanish and in English with the same broadcast. COVID has forced us to take measures that we wouldn't have otherwise. We would have loved to have this session face to face, but today times are forcing us to work harder than ever, and that's why this session is not face to face. The panel joining me is wearing their masks. Only me that I am talking. I am not wearing my mask, but just for now, during the welcome, the rooms have been sanitized. We are respecting the social distancing because our main goal is to take care of everyone's health. The main goal is to inform, just as every other session, to clarify processes that we are carrying out, informing you of next steps, and keeping this discussion open. Today, I have with me Dr. Alejandro Calderon Alipi. He is the National Coordinator of Supply and Drug Supply in INSABI. We also have Dr. America Orellana. She is the Commissioner for Health Approval at COFEPRIS. America, and Mr. Giuseppe Mancinelli, he is the Regional Director of Unops in Latin America and the Caribbean. So, welcome. Today's session will last 90 minutes. We have expanded half an hour, unlike the previous one, with the difference that today we have received all of your questions and we would like to answer them on the air. Let me explain how it is going to work. But first of all, I'd like to thank you for your interest and for all of the questions that you have sent to us. Well, Dr. Calderon first will explain the general progress in medical supplies and drugs acquisition in Mexico, which is the main matter at hand. Giuseppe will be explaining on the progress in this drug procurement and acquisition and next steps. And Dr. Orellana will tell us a little bit about the steps on equivalence registrations, assessment processes, and at the end we'll have the Q&A session. Without any further ado, I would like to share that we have received your questions. You can still send questions at unops.com. And without any further ado, we know that you have seen through the media and through a morning press conference with the president on the progress that the Mexican government, along with Unops, is having in this drug acquisition procurement. So in this context, Dr. Calderon, could you please explain what is the progress and how the government in Mexico is working in this procurement, expectations, etc.? Thank you very much. Good morning, everyone. Thank you so much, Erica, for introducing me. And on behalf of Mr. Juan Antonio Ferrer, Director of the Institute of Health for Wellbeing, INSABI for short, I would like to welcome Mr. Giuseppe Mancinelli, as well as COFEPRIS representative America Orellana. Good morning, doctor. And all of the representatives from the different countries that join us today, as well as the pharmaceutical industry, both national and international, that are interested in this procedure. I would also like to thank your participation and attention to this second information session in terms of medical supplies and drugs procurement for 2021-2024 that will be carried out by Unops in terms of the agreement that said UN office agreed with the INSABI. INSABI as a mandate of the constitutional president of Mexico, Andrés Manuel López Obrador, has committed to enforce the right of health for all of the inhabitants of our countries. This is explained in Article 4 of the Political Constitution of the Mexican United States. In order to achieve this, one of the main pillars is providing medical attention for free to all of the population that's in national territory. This will set a precedent in the history of our country, since it is a substantial transformation in terms of social rights. However, in order to achieve this, we must face stagnancy, corruption, and different processes that have rendered inefficient and little transparent in terms of medical supplies and drugs procurement in the past. I would like to communicate that the multi-yearly meeting has as a starting point the added demand that INSABI integrated based on the requirements of the needs proposed by the Ministry of National Defense, the Ministry of the Navy, and the National Institute of Social Security, the Institute of Security and Social Services of the Workers of the State, Virmex, Mexican Oil, and other institutions that are part of the health sector in the country. The federal government, through INSABI, is carrying out a deep transformation in terms of drug and medical supplies procurement. This constitutes the basic input to provide free services to the population without social security. In order to carry out this transformation, it is important to have the support of Unops, with which transparency criteria and zero corruption criteria have been established, guaranteeing the amount of input acquired to the best prices and from suppliers that meet processes timely. The impact of this procurement in the health system will be reflected in three very basic points, although very important. Economic, integrating demand of drugs from all of the public institutions in a joint procurement, we can negotiate better prices per unit compared to past that paid any of the institutions that any of the institutions that are participating today have paid. It also allows negotiating delivery conditions that are more favorable for the state. The exchange of input. When buying the same product for all of the institutes, it will be easier to exchange them if they are necessary. And we can also carry out a rational use analysis for medical supplies. Since it is the same drug for all of the institutions, we could take in hand. Mr. Mancinelli, in the media, there have been news about processes, ongoing processes. Could you tell us about the current status of these procurement activities and what should we be expecting from the market, please? Thank you so much, Erica. Well, first of all, I'd like to thank you, Alejandro Calderon, in representation of INSABI. Thank you so much for being here with us today, as well as America Orellana representing COFEPRIS, Federal Commission for Protection Against Health Risks. It is very important to have you with us today. And also, I'd like to especially thank all of the participants in this second informational session. There is more than 1,300 people connected, and that is of utmost importance because we truly want to provide information on the progress, how everything is going, to have periodic meetings, of course, on the basis of certain advances and progress that could be attained, hence informing on important progress. Because, of course, there's a lot of interest in knowing how things are going. So this is the goal of today's session. And now I will start with my presentation. So please be patient because I'm going to share a lot of information. So thank you so much for the patience you will be having. So we are going to start with an aspect that for Unops is fundamental, which is our behavior framework. Tender processes that are known by the UNOPS are under a public management environment that's fair and equal. That to us is fundamental. There are universal principles that help tender processes to be carried out in the best way possible. We are talking about being transparent and offering the best integrity as well as efficiency, innovation and technology, the participation of the private sector, also gender equality and diversity. So all of these helps us offer a sustainable value. This means that we can offer competitive and fair prices in quality and efficient product. We are monitoring press. We have received a lot of requests for meetings, for information share, and I've seen that many times quality is an aspect, an issue. Well, quality is not under discussion. The aim is to receive the same quality or even better in terms of drugs and medications because, of course, well-being of Mexican inhabitants is of utmost importance for INSABI, COFEPRIS, and the rest of the public institutions in Mexico. What we aim to achieve is an efficient supply of drugs for the Mexican population. Dr. Calderon already talked about 110 million of users. So this is the main goal, an efficient supply, an effective supply, but also make procurement processes easier. We want to do this through open competition promotions for the Mexican and international environment. What does this mean? In Mexico, it is known as stable floor and as the even floor. Fair UNOPS procurement manual. We have also created a section of frequently asked questions. So the tender process questions will be addressed during the tender process because part of the procedure is adhered to confidentiality aspects. We are also carrying out general information sessions such as these ones. Some are more specific and I will refer to them later on. We have training courses free of charge by UNOPS. And last but not least, the contracts that will be awarded after the tender process known by UNOPS will be published in the webpage of the UNGM, which is the Global Market of United Nations, and I will be also referring this one later on. This is very important for the entire universe of the stakeholders and those who are interested in knowing information since they will be having access to all of the awarded agreements and contracts that will also be published. So now let's talk about the progress of the procurement process of drugs and medical supplies and critical drugs and medications. And for this, UNOPS has conducted a series of tender and negotiation actions, that I will refer later on, under patent and unique source, as well as competitive processes for critical products, and last but not least, international public tender of multi-processes. This translates in the fact that, well, first we're talking about more than 360 codes divided between patent drugs, around 5 codes, and expedite acquisition drugs, which is 262. And this is for supply in January. On the other hand, we will have more than 1,600 codes of drugs and medical supplies, which tender will start very soon with a supply as of May. So now let's elaborate on each phase, on each acquisition procedure. We start with progress in patented drugs. This is the first procurement process under regulations that apply to UNOPS. UNOPS has created a highly expert group that have led negotiations. These negotiations have been made aware for 2 weeks with a clearly protocol with clear rules. There have been satisfactory regulations with 26 companies that are patent holders. 39 codes have been registered, and right now we are in the final stage. Of course, this has been a very complex process, very demanding process, and I'd like to officially thank the companies that have participated for their professionalism and their seriousness in the patent negotiation processes. Right now, we are finishing the validation of numbers of quantities, because we have to understand that all of the acquisition and procurement processes is quite complex and has to do not only with a number of codes and high volumes of drugs, but also with an articulation with several stakeholders involved, not only from the market and the pharmaceutical industry sectors, but also on regulatory agencies and institutes that are participating and that are interested in receiving said medications and drugs. Hence, we are doing things in such a way that each step is a firm one, so that we can have information clarity. So right now, in terms of patent negotiation, we are validating the amounts, and we are carrying out the final award according to control and approval mechanisms that UNOPS holds. This to ensure supply as of January 2021. This means that we are concluding the notification portion of the process. We are finishing demand consolidation that we've received offer-wise, and then it will be translated into an agreement signing. I would like to emphasize on the fact that UNOPS is adhered to a control mechanism that ensures the procedures that we do in such a way that each step, each instrumentality, each institution is revised by intersectorial committees that control the mechanisms that we are doing. So hopefully in 2 weeks maximum, we'll be able to conclude patent negotiation of the 99 codes, hence issuing the agreement so that the company can start production phase for supply as of January 2021. Also, I'd like to share a very important aspect, which is the initial perception of the market. For us, the process that we have been carrying out in terms of patent has been very useful, as it has been a feedback to know what was information and input that companies wanted to provide to the process. And we have received very valuable inputs that will be useful for the joint work that has been held by the Mexican government and UNOPS. First, we have had clear rules during negotiations. Companies have been very thankful. They have appreciated that rules were clear in terms of defining what was the exact amount that's going to be paid, because we understand that on the part of national industry, there's an interest to know what are those amounts, because they have a productive process that they have to keep. There's also a distribution aspect that they have to adhere to. So this also helps companies to be certain in management and financial aspects. Also, conditions that allow financial sustainability of the company's payment certainties, for example, acquisition on purchase and procurement specificities. All of these offers certainty and clear rules on what's gonna happen. So hopefully we can have positive results briefly soon. And of course, there was a situation with one of the patent holder institute that was very appreciative, and they're very satisfied by the participation of UNOPS in the consolidated procurement. And this is very important, and that's why we wanted to share this so that it is evident, and also in an appreciative manner with the sector. This slide is a little bit more elaborated on the composition, the 105 codes. And you can see that we are talking about almost 30% of these are oncological drugs, which are the highest priority, but also we have a significant part of endocrinology, cardiology, hematology, and other diseases that I will discuss in detail later on. This is important for the sector to know what type of medications and drugs are being procured. Now we are going to talk about the second largest group that we are bidding now, which is generic, unique source, and medical supplies materials. Right now we're talking about 200 codes now for procurement processes, and the UNOPS has already carried out some activities, some actions. For example, the validation with suppliers in terms of inventory availability for the first quarter, in terms of these codes required. Different suppliers have offered this information. Also, tenders that have already been carried out and that will be carried out will be under an expedite process, because we want to conclude this process as soon as possible so we can ensure supply as of January. In terms of UNOPS, on 11 of November, they have launched an expedite procurement for 36 oncological codes. We received proposals on November 17th, and in these days we will validate amounts. And once we're done assessing these 36 codes, on Monday, we will launch other requests for the remaining codes, 226 of them. This will be on September 7, and we are estimating for next week, on the 14th, to be the last day to receive offers. We are giving very short times so that we can guarantee supply as of January. And the assessment and awarding that UNOPS will do for contracts will happen this year. That's our commitment, that's the goal. Of course, this depends on many factors, not only the effort that UNOPS is adding, but also it depends on the response of several companies that they can quote all of the codes. But our commitment is to do it by this year so that we can guarantee supply as of January 2021. And in this case, you can also see the breakdown of what are these 262 codes. You can see that the generics represent most of it, a unique source, and medical supplies, and with the breakout of oncology, infectious diseases, cardiology, hematology, and others. So now we are going to talk about the international tender processes, the public and open tender process. The first news I'd like to share is that we have divided this one in two tenders, one for drugs and medications and the other one for medical supplies. The other news is that tomorrow the tender rules will be published. So I beg of you to be attentive to UNOPS calling so that you can have access to the tender documentation and the different activities that this entails. It is important to mention that this international public tender will be done under regulations that the UNOPS states. Understand that there's a lot of interest to know what are these procedures, and it is very important that this tender is going to be published in the UN global market. That's why I beg of you to be attentive to enroll to global market. It is a fundamental requirement to be able to participate. And we are talking about more than 1,000 codes of drugs. So what are the main milestones and the next steps? Tomorrow, the tender is going to be published. We will have one specific clarification session on this tender. Remember that almost 70% of the requests that we have received have to do with the tender process. Well, once the tender process has started, then we will have a mechanism to address all of the concerns and questions and doubts that the tender process is causing. And for this, we will have a specific clarification session between December 14 and 16, and UNOPS will tell you how it will be carried out, so you can ask anything about the tender process. Hopefully we will have opening and presentation in January 18th. Of course, we will have to give a little bit more time in acquisition processes and procurement processes. We are talking about a supply as of May 2021, and as of the presentation and reception of offers, there will be an assessment period of time that UNOPS will have. So hopefully the awarding will happen in March and supply will be in May. Why as of May and not as of April, you may be wondering. Well, we have to consider that the UNOPS is carrying out all of the possible efforts to anticipate the best way possible supply before April. It is, of course, a commitment. However, we have to take into account times for tenders and bidding processes and awardings, but we will do it as soon as possible, of course. The second part of international tender has to do with medical supplies. And it's important to see that the publication is going to happen on December 11, and the clarification session will be done from the 16th to the 18th of December. There will be information about it, of course. And that's why there is a gap between these dates. And the offer opening will be January 25th, and contract awarding will be in March, because there's a previous process for approval and assessment of those contracts. And supply will be as of May 2021. For medical supplies, we're talking about the more than 600 codes, and now we are going to see a little bit more in detail in the next slide. In this case, we have 1,657 codes. Generics, of course, represents most of it, along with medical supplies. And there's also a smaller part regarding patent and unique source. And you can see what they are about. Medical supplies, I think, is quite evident, as well as most of the drugs are for infectious diseases, oncology, neurology, endocrinology, etc. Well, a very important aspect for us is for you to be able to enroll, for you to know what the global market of the UN is. I insist, it is a fundamental requirement so that you can participate in the tender process. In this case, I just talked about medical supplies and drugs and medications. But in terms of the UN system and the UNOPS will be not only an opportunity to enter a tender, but also an opportunity to expand your participation in the process of tenders and bids. So please get to know the global market, enroll. In this slide, we have offered drugs codes, because there are many of them that you have to know. These are the codes and keys so that you can know about it. It is also accessible for all of the interested stakeholders and companies. Trainings in order to become a supplier will also be provided. They are official and they are free of charge. You have all of the information here, and of course this presentation will be shared so that you can see the specific web page to enroll. And UNOPS, of course, wants to guarantee open competition in equal conditions for the national and international markets. And in this digital system, UNOPS has a tool and a platform that's called e-sourcing. This digital platform is the one that UNOPS uses for the tender and bidding processes. And all of these processes include identifying supplier sources, calling for a tender, opening for offers, assessment processes, and agreement and contract awarding. There are no more papers, and this is a system that suppliers and UNOPS lead so that everything is online and transparent and open to all of the stakeholders. It also offers information on how to learn to use this online platform. I ask for more minutes. Please, a little bit more of your patience. In this slide, I want to share something that's very important, not only for UNOPS, but also for all of the United Nations system. How can we add value in the procurement process that we are offering? What we normally consider as sustainable acquisitions and procurements. How can we integrate sustainability in all of the acquisition process that we are conducting? Well, through the usage of drive programs and a sustainability form that allows to maximize the economic, social, and environmental impact. What does this mean? This means that UNOPS during those days has sent a form to all of the companies that have participated in this tender process that I just explained. And we have received a very positive initial feedback, and I am very glad of that personally. But the idea is to have a commitment that's absolutely voluntary, and I like to officially thank that commitment on behalf of the companies that see that this is going to have an important impact to the sustainability of the tender process. It is not merely a tender that wants to get drug supply, but also to see how to improve this tender with a global commitment of sustainability. And there's a lot that can be done with this, a lot that can be done in terms of corrective actions, work and labor related actions, environment management, etc. There are a lot of things that can be done. And this, of course, has to be considered as a complement of international policies. So all of the inputs that we can obtain from this drive program and the inputs that companies send can be considered as measures to address opportunities related to sustainability, but also to complete development plans in Mexico 2019-2024, foreign affairs goals, and the SDGs. And here we can basically address gender equality, non-discrimination and inclusion, and combat corruption, and other aspects as well. The aim is for companies to have a level of maturity in the area of sustainability so they can increase it later on. And to conclude, I will share the multi-yearly procurement process. This hasn't changed compared to October 5th session. We have the main 5 milestones for 2022-2024 procurement and supply. In March, we started with estimates and quotes. We will also have an RFI activity, and then we will negotiate patents and medical supplies. And the awards will happen in October and supply as of March 2022. Of course, we will have more time for this, and we will provide some feedback on this multi-yearly procurement process. So, of course, the end goal is to guarantee quality and quantity of supply as of 2022 and up to 2024. And with this, I conclude my presentation. Thank you so much once again for your patience. I know that it was long, but I think it was very important to share all of the elements that we have been working on and the main progress. And now I pass the floor to Dr. Orellana. I don't know, Erica, if it's okay. Yes, before that, I just want to thank you for this elaborate information. I would like to remind you that this presentation is going to be available hopefully in 1 or 2 hours after the session is done. You can go to the webpage of proyectosaludmexico.org And in the same web page, in events sections and news sections, we will be notifying on these dates more specifically, so we can complete information with that. And Dr. Orellana, please, a very important part of this process, of course, is the health registry process, and we understand that there are some news. So if you could tell us a little bit more about it. Thank you so much. First of all, I'd like to greet everyone. Dr. Giuseppe Mancinelli, Dr. Alejandro Calderon, in charge of Drugs and Medical Supply Division, as well as Erika Paredes, our moderator, and all of the participants joining us today. Yes, on behalf of Dr. Jose Alonso Nubelo, that couldn't join us today, we are going to talk about everything related to equivalence processes and the registry process that will cover all of the drugs that are not registered in Mexico yet, but according to our standards and regulations, we can consider them as a priority in our tender processes. So, next, please. First of all, I'd like to remind you of these equivalence agreements and clarify many questions that have arisen with these documents. Of course, these documents, these agreements that have been published in the official journal are requirements and processes for assessment with different regional authorities and with high demand authorities. And first of all, well, we started with this agreement in 2010 through recognition agreements for the US and Canada authorities. But this was specifically for medical devices. Now, this sets the basis to accept this recognition of requirements and assessment processes for all of those medical supplies that are classified in terms of risk in class 1, class 2, and class 3. So, when we saw all of the benefits that these first agreements offered, then as of 2012, agreements continued. The first one was with Japan in the case of medical devices, where we also accepted the inclusion of class 1, class 2, and class 3 devices, and afterwards we continued with drugs and medication. Everything having to do with those that have been approved by the specific agencies in Switzerland, the European Commission, and everything related to the US, Canada, and Australia. By 2019, in March, we published the next agreement where this equivalence was recognized for all of those medications that entered this pre-qualification scheme on behalf of the WHO. By 2020, we continued with the agreements. We started with January 28th agreement, where we compiled all of these agreements and we considered now other agencies that have the same level as Mexico, as COFEPRIS in this case. We're talking about the agencies that are national, regional, level 4, that have been qualified by the Pan American Health Office. Now I want to mention all of the agreements. What do we see here? What are the requirements? Yes, next one, please. all of the requirements. Here we want to show you what is COFEPRIS assessing in each of the processes. We have a traditional process where a requester that could be national or international submits their application. And these are the different packages that are reviewed and that have to adhere to the right efficiency so that they can receive an approval. So in the traditional train, we can see the package of administrative information, which are specific documents. And if there, of course, there are differences between regions, but we also have a legal package of information, everything that has to do with documents that have been issued by other institutions that in some cases are not the regional health authorities that are involved, but at times also trade and commerce ones. We also have all of the labeling processes, all of the information that's targeting health officials. Afterwards, we have quality package for each of these input, raw material, all the way to finished product. In the case of medical devices, everything having to do with usage safety, and mainly if we are talking about input that are targeting generic markets, then all of the tests and studies that prove this exchangeability. And for new molecules, everything having to do with their efficiency and effectiveness. As you can see here in small letters, we see that the legal times for these generic drugs are 180 natural days. In the case of new molecules, the legal basis indicates that we have a term of 240 natural days in order to address them and to offer a response. If we go towards recognition agreements, we see that this package of information is kept and there's a reduction in delivery times. This reduction goes to 60 working days. Of course, here in this recognition agreement, we simplify processes because, of course, there was a previous authority that already carried out an assessment of quality, safety, efficiency, and effectiveness, and we use this to reduce time. Now, if we go to the last agreement, this is where we will have the splendor of simplification. Everything related to administrative processes that should be also integrating the equivalent document to health approval. So we have this legal package, everything having to do with labeling. It also supports quality, exchangeability, and effectiveness. Now here, times set by the new agreement that was published in November this year is that we have 5 working days to provide a response. And these are has caused many questions throughout the process. How is COFEPRIS provide a judgment in 5 days? Well, very simple, because we recognize requirements, assessment processes that are equivalent to the ones that Mexico has. So the registration official document that has been issued by the authorities that we have just talked about will allow us to simplify what information the registry will receive, that it is a quality product, that it is a safe product, and that it is an efficient product, an effective product. Next, please. Now, in COFEPRIS, how is the process of drug and medical supplies supply and procurement? Well, we start with the registry. And as you can see here, From step 1 to step 5, COFEPRIS is involved in everything having to do with health control. In the case of the first stage, which is registry, which is the ideal aspect for those who want to integrate to this process with UNOPS, to request this registry so that when they start moving forward in tender processes and contract awarding processes, they already have their registry official document. So we start with this one, and of course, they should submit all of the information having to do with quality, safety, effectiveness for medical supplies, everything having to do with use, safety, and also something that's very important. Also in this simplification that we have both administrative and times for delivery, all of these stakeholders interested in this process, of course, will be for health sector submittal. Right now, they cannot be sold to the public. I'm talking about the private sector, of course. All of this input will go for health sector supply and provision. The next step is contract awarding, all of the codes that have already been mentioned. We have many candidates that will have a national registry, some that won't have it. But of course, we are going to apply the agreements and we will recognize regulatory agencies of high demand. Afterwards, we will have import aspects. All of the processes or drugs that are manufactured abroad, with or without health registry, need an import permit, and this one is granted by COFEPRIS. In this process, we also have an alignment, and we will also respond in simplified times. What do I mean by this? We are talking about no more than 48 hours for each of the importing permits. Now, the release of the batches of the lots. Here the situation is that, as you very well remember, the agreement on the 28th mentioned that COFEPRIS for import aspects would be taking lot-to-lot samples to bring it to the analytical and coverage expansion control process in order to determine if this input had the right quality. Of course, here we are not going to do this part anymore. Why? Because all of the process and all of the chain sets a previous approval. So the head of that approval will be the responsible of the release. In Mexico, we have many schemes. We can use authorized third parties. These are test and trial laboratories that can carry out this analysis, and with this we can prove the quality of the input. Now we go to storage and distribution. This is a very significant and important aspect, since if something fails in this process, then the input can lose all of these qualities and generate a risk, and this is what we want to prevent. So, COFEPRIS is carrying out verification tasks and efforts to verify the situation that these establishments are under, so that we can guarantee that they meet everything necessary to store input, but also that this supply chain adhere to best practices. And last but not least, we have supply, and this is where other agencies and institutions will distribute inputs so that they can reach the population that needs it so. Also, something that has been asked a lot is quality control. So what's COFEPRIS going to do? Well, COFEPRIS, of course, has post-commercialization of inputs. This program is a program that has been carried out for many, many years, where COFEPRIS, in order to confirm the quality of this input, go to distribution points and they take a random sample. So it can be sent to the lab and it can be determined that in the POS and the point of delivery, this input was kept in the right conditions. And of course, quality is not impacted, because if it is, then safety and effectiveness of input is also affected. Next, please. So let's talk a little bit about medical supplies. In Mexico, we have risk classification of medical supplies. These supplies, of course, are in the category of medical device. We have those that are low risk, class 1, class 2, class 3, and this is a very important aspect. NR. NR means medical supplies that do not require any COFEPRIS registry and that are integrated in the list that we already have of the codes that are going to be included in the process. It's very important to mention this. You can see that most of the codes have to do with class 2 medical supplies. Then we have class 3 medical supplies, and then class 1, and then low risk. So all of COFEPRIS processes have been aligned so that they can be assessed and go to this simplified process in the time that has already been established, the 5 days I mentioned before. So in COFEPRIS, we reduce this code universe so that we can have all of the capacity necessary installed by December, so that we can respond so that everyone, all of those receive their health registry. It is also important to mention that for this case, those who want to know more about the medical supplies that do not need a registry, 2 agreements have been published, one in 2011, other in 2014, and both of them complete each other. One does not render the other one null, and that's where you can verify if they need a registry or not. And with this agreement copy, where this input is listed, of course, you won't have any further problems for the process, for the corresponding process. Next, please. Now let's talk about import. There's another question that we've seen. How am I going to submit import documents and what are the requirements? So in COFEPRIS's webpage, we have all of the standardized codes. These are online procedures, and this is very important to mention, that we have online procedures section, and this works 24/7. It's open always, so we won't have any problems there. And they can submit their request through BUSEM in order to submit for import requests and permits. So this covers all of the drugs, and the codes that you will use to identify is the one that's here, 001-009C. And I will just virtually read it. This is a right payment receipt with the fee that the Federal Law of Rights states. Everything having to do with a health license that's current and valid, with the right category. There's also a notice for responsible approval for current health registry issued by the regulatory agencies mentioned in previous agreement. All of the public instruments, that credits legal personality of the promoter, everything under oath, of course, so that the head of the drug abroad commits to adhere to 28th agreement. Now, this letter is because in the 28th agreement, you very well remember that it is mentioned that once the first import is carried out, there will be 5 days to start registry process. And the next one is for medical supply. It is also very important to mention. The code for this is COFEPRIS 1014A. This is quite similar to the one for drugs because it is a generalized process, the one that's carried out. So of course, we have the payment for the service that COFEPRIS grants, everything having to do with licenses and permits, the approval or health registry per se, the legal credit of the public instrument, and the statement under oath that they will receive the registry if they adhere to the 28th agreement. So that's all I wanted to share on behalf of COFEPRIS, and thank you so much for the time that you have given me. America information has been quite detailed and elaborated. I hope that most of the questions have already been addressed because most of them have been related with this. Now we are gonna go to the Q&A session. We have received 180 questions until yesterday. We have half an hour to try to go over your concerns, and we would also like to use this opportunity to address those questions, and at the end have also an opportunity for the institutions who were not able to send their questions do. As you can see in the presentation, there's a link, www.slido.com, and if you enter code 17,000, you can enter additional questions. So we invite those associations, as well as the embassies and the consulates having other questions, so please send it to us. We have received many questions by the different chambers, the Pharmaceutical Industry National Chamber, the National Association of Drugs Manufacturers, etc. Many questions. We have prioritized the questions that we will be going over today, the most strategic ones that are most relevant for this phase of the process, and of course the ones that could benefit the international and national market. And at the end of the session, these questions that you have sent through slide.com will also be addressed later on. So without any further ado, we will go for the Q&A session. The first one is by Mr. Juan de Villafranca, Director of AMELAF, and he asks, is the Regional Observatory of Prices announced by UNOPS with open access be kept? AMELAF is the Mexican Association of Pharmaceutical Laboratories. Giuseppe, please. Yes, the Regional Observatory of Prices is an internal instrument by UNOPS, and it is based in having public price listing in the region. Is a very valuable instrument because it allows to have a baseline to be able to compare with the prices that we have been obtaining in Mexican tenders. And it also allows to have a cost reason. This is why it's an instrument that we have wanted to keep open. It has kept open in terms with COVID-19 prices, the pandemic prices. However, it's still an internal instrument used by UNOPS. So for now, we don't consider that it will have a complete open access, but we will find a way to potentialize this tool so that eventually it could be also one that can be accessed. But that's something that we have to discuss at UNOPS. Thank you, Giuseppe. The next one. We have received many questions by 3 different institutions, FIFARMA, AMIF, and PHARMA. One of these questions is, will UNOPS be able to substitute or replace products of the same class? If so, what criteria will you be using? And under which authority will they be able to do so? Alejandro, I don't know if you want to help us with that, Alejandro? Yes, Erika, of course. In terms of a product replacement, UNOPS won't be able to. It would be through INSABI. We analyze this replacement attempt of a code. We will assess with the technical expert team to see if this replacement or substitution is favorable. And once it's defined, we will go to UNOPS and then they could replace the code. Alejandro, thank you so much. We have another question by Carlos Ramos, Executive Director of the National Association of Health Input Distribution, ANDIS. What will be pharmacovigilance mechanism that the government will be implementing for pharmaceutical industries that are not established in Mexico? America, please. Yes, of course, Erika. Well, of course, here we will go over everything having to do with pharmacovigilance standard and norm. Here it is very important to add that it is not only the holders of the registry, the ones that are forced to carry out a pharmacovigilance effort, but also all of the medical units that also have rights and warranties. All of the patients and treating physicians that have seen reactions could notify them to COFEPRIS as well. And of course, we are going to also use the tools that we have at an international level. For example, the VG flow, where we can also find all of the notices at an international level of any reactions that could be caused by some drugs, whether adverse, non-expected adverse reactions or inefficiency, ineffectiveness, and everything having to do with technovigilance for medical supplies. Great, thank you so much. Next question. This one is by Socorro España, Director of ANAFAM. Have you defined logistics processes with Virmex, or will you hire new logistics operators to support with this? The National Association of Drug Manufacturers. Yes, Virmex is a company that will be helping distribute drugs, but in the first stage, of course, we have considered to keep on using logistic operators processes, and this is something that Virmex has been doing, and they have already implemented 11 warehouses, and most of them are in Mexico City, in Mexico State, and Hidalgo State. And along with logistic operators, that's how logistics and distribution will be carried out. Perfect. Thank you so much. Next one. This one is by Arturo Manriquez, General Director of DILAMEC. One of the principles regulating UNOPS procurement activities is effective procurement processes with the same rules for everyone. We are talking about an even ground that allows all of the participants of the tender to enter information with the highest standard levels that offer quality and cost according to UNOPS. The financial regulation of UNOPS states that the competitive process will have to guarantee prudent commercial practices. Giuseppe, could you help us with this question? Yes, of course, this is a very well articulated question. Let me refer to what I mentioned before. In the tender processes of UNOPS, we find that they are based on universal principles that I already mentioned: transparency, integrity, effective competency. So the application of these principles warranties being able to have a highest participation in a better relationship in between cost and quality of the different suppliers. This is the way we conduct tenders and biddings, and this is the way it has worked, not only in Latin America, but also in the rest of the world. And of course, hopefully, this can also be reproduced in Mexico. I understand that also the financial regulations were mentioned. UNOPS's financial regulations represent the bylaw. I mean, these are rules that are based on a series of procedures by UNOPS. And of course, the idea here is to have the best results, guaranteeing the best practices by the different companies. But well, that's the way in which the UNOPS has been created. Financial rules have been approved by our board of directors and the General Assembly even. So this is the reflection of what the member states demand from UNOPS, and this is why we work the way we do. Thank you so much, Giuseppe. Giuseppe, next question. This one is also by Juan Villafranca, Executive Director of AMELAV. So non-holders of health registry, are they going to be able to participate? A letter is going to be required? If so, America, please. That's a question that we are still going over. It's kind of confused to me. I don't know if it's the terms, the words that this person used. And I don't really want to give any erroneous or information. What letter is he talking about? So, Mr. Villafranca, if you could help us, you have our email to expand this question so that we can elaborate. It would be a pleasure to act as a liaison with COFEPRIS. Next question by Maria Carreola from Canifarma, National Chamber of Pharmaceutical Industry. The requirement of input code for health sent by INSABI to UNOPS covers the entire needs of the federal health sector. Alejandro, this one is for you. Yes, as I discussed during the presentation, it does cover the needs of all of the health institutions throughout the health sector, and that's the answer. Yes, it covers all of the needs. Perfect, thank you. Next one, by Socorro España, Director of ANAFAM. The amounts established in the requirements are 100% procurement commitments, or is there only one possibility? Giuseppe, please. Yes, of course. The amounts established in our requirements are firm commitments. That's what I was saying before. Having certainty on the conditions that establish the different procedures. For us, it is very important for the market to have that certainty, because only on the basis of that certainty will there be competitive offers, those that can offer certainty in continuation. Hence, what we will be tendering, or what we have negotiated once the main processes have been done, will be a specific amount. It is not a desire, but a commitment that's going to be reflected in an agreement, in a legal contract. And of course, it also addresses to a legitimate demand and a calculation that has been done by INSABI and the different institutions. That's why we have prepared to validate data, so there can be certainty and that it can turn into data and information for the company. So it is a firm number. Thank you very much. Once again, Carlos Ramos, Director of Andes. How many new registries of foreign companies not based in Mexico and without any activities in Mexico have you already granted and delivered in a week? That question is very interesting. I want to add that we did offer the dates in which all of these registry processes were started through recognition agreements. And in one review yesterday, in everything having to do with databases, we have a total for drugs of 1,243 registries granted to foreign holders. For medical supplies, we are still going over that information, considering that COFEPRIS has a higher volume in health registries for devices. So it could be double, it could double the amount. Yeah, it could be double that amount. What we can tell you for sure in the case of devices. So next questions. Probably Alejandro is the best to answer. Maria Carreola from Canifarma. Health sector institutions, do they know about the delivery days established by Unops? Yes, all of the institutions participating are aware, they have been informed. Actually, the information that we share with the institutions is the one that Giuseppe Mancinelli has just shared, and it's the same for everyone. The next one is from Arturo Manriquez, Tilamec. What is the participation that authorities have during the public hiring activities and international practices, particularly the IRS, the Ministry of Economy, COFESE, and in the case of fiscal agents, what's the main role of the Federation's institution during this process? Well, all of the ministries mentioned in the question have participated with us very closely from their competencies. IRS, COFESE. IRS is a very important part of this procurement since they're the ones helping to get the resources, to obtain the resources before time so we can have an expedite procurement process, so we can ensure also the a priori payments. And just to conclude, and in terms of the Federation audit, they haven't requested information yet. They will have to at some point, but it's important to clarify that we are working in coordination with the public office. They have been accompanying us so that there aren't any problems later ahead. Thank you. Next question. Socorro España, Director of ANAFAM. Payment process, is it going to be only with UNOPS or is it going to be paid with each institution? Yes, of course. Well, payment procedure is going to be done directly with the UNOPS. The scope of our services is not only conducting tender processes, but also signing the agreements with the different suppliers that have been awarded, and of course the payments that are going to be carried out. And for this, of course, there's established procedure that has to be agreed with INSABI. So we need to have a positive acceptance of the drugs. But everything having to do with payment procedure is done by the suppliers directly with UNOPS. And for this, of course, when the contract is signed, each supplier will be explained what the procedure is. We need to fill a supplier's form so that they are registered as UNOPS supplier. They will have an account created for them, so Once they conclude with internal acceptance process, then payment procedure is easy and simple. And that's one of the most important things for the market, that payments are gonna be done in very short times so that there can be a possibility by the company to have the right resources to continue with the process. Thank you so much, Giuseppe. Now the questions that we've received in Slido, and we have many of them, sorry. We have like 50 or 80. So I'm gonna go very quickly with the main ones. This one is from Francisco Ramirez, from Fresenius, Cavi, Mexico. So the company awarded, will they only be based on price, or they will also take into account quality aspects? Giuseppe? Yes, of course. In the tender rules, there are a series of requirements that have to be met. So, of course, quality aspects are fundamental requirements. Hence, companies and suppliers have to meet those quality criteria. Of course, criteria is to take into account. And price variable is one that's related in a competitive market, because many companies, once adhering to the previous requirements, of course, will have an opportunity to compete in terms of price. But quality, of course, is a fundamental requirement, as I said before. This question is by Mr. Hernandez. For priority drug delivery, what's the delivery date and the delivery place? Maybe you can help us with that? Yes, Mr. Hernandez. Priority drugs that are within the expedite procurement process are scheduled so that they arrive in January. That's the first and second week of January. They will be arriving to the warehouses that each institution asked for. This will be with Virmex's coordination and assistance, as I said in the previous question. Perfect, thank you. This is for Dr. Orellana. The exchangeability, is it going to be accepted only if it's done in Mexican patients? I think we have to clarify the question because it is not very well stated. Exchangeability tests are 3 types. These are those drugs that, because of their pharmacokinetic, pharmacodynamic nature, are not absorbed, so they are not distributed, hence they are not cleared. And of course, these are quality tests that do not require patients. They do not require any human being involved. The second test, which would be dissolution profiles in an exchangeability test, it's also a lab test with qualified teams, well-structured teams. But if what the person asking is talking about bioequivalence, then they do need to happen in Mexico with volunteers, and COFEPRIS needs to approve a research protocol because they are using human beings. So, of course, it is very important to mention that the registry is targeting health sectors. We are not going to any other private commercial market. Now, also consider that all of the drugs and inputs arriving are from high demand authorities, high surveillance authorities. This is very important. So we have to clarify the rumor, people saying that we are going to flood the market with Chinese products, Indian products. This is a time to just eliminate those rumors, Thailand, I've even read. Of course, what's gonna go to the health sector are all of the drugs and medical supplies of the highest quality. And how do we certify this? Because they have been registered by a high demand and high surveillance and vigilance authority. We won't include any country that could jeopardize the Mexican population. Thank you so much, America. Next one, Carlos Ramo from Andes. Would you consider service and management distribution to keep the integrity of the supply chain in best procurement conditions? Alejandro, please. Yes, of course. Carlos Ramo from Andes, hello. Yes, as I mentioned before, we do have considered support, looking for the support of logistic operators so that we can ensure the integrity of the drugs reaching the places that they have to reach. Virmex is helping us organize that aspect, and in the future, Virmex will be able to do this work themselves. Great, thank you so much. Now, Jose Cuevas, he's a manufacturer. Are the 262 acquisition codes for the expedite acquisition? Do we know the awarded companies as well as the assigned prices? Giuseppe, please. Yes, I mentioned that in my presentation. UNOPS's attempt is to publish all of the contracts that will be awarded in the global market. So I would like to remind you to please enroll to get to know global market, because they will be published there and you will have access to all of the related information. I understand that it will be detailed information because the agreement has to be completely transparent in terms of amounts, prices, signatures. So yeah, the answer is yes. Thank you so much. We just have 3 more minutes to conclude, and we still have a lot of questions. So what I proposed to be able to address these questions, there are many questions that we have received that will be answered directly in the tender documents. As Dr. Mancinelli said, these questions cannot be answered right now because they will be answered in other ways because of confidentiality aspects. So it will be in the tender documentation that will be in December 14th and 13th. And also, just as in previous session, we answer to each of your questions. So please be sure that you will be receiving an answer to your emails. And these questions are also going to be uploaded in the frequently asked questions part of the web page. There are some of them that have been anonymous, and we won't be able to send you the answer, of course, because of that. For those who have sent their contact info, we will be sending you the answer. Now, tomorrow, the tender rules will be published for the drug public tender process. Please be very attentive of this information. It's also going to be in our webpage, and the next information session we will be going more in detail in each of the questions that you have. So on my part, and on behalf of the panel members that joined me today, thank you so much for your time. Thank you so much for your participation. Hopefully this information session has been of benefit, that we have addressed your questions and concerns. We know there are more, so we are going to make an additional effort to answer each and every one of you. So thank you so much for your participation.